The Tumor Immunology Program takes advantage of the relatively recent appreciation that the immune system is capable of controlling and even eliminating cancer.
How the immune system recognizes a tumor is a very individualized process from patient to patient. And so we're trying to piece together the insights we can learn to determine how that interaction takes place.
Just 25 years ago, most scientists would have thought that the immune system could never see a tumor. The argument was they were always so similar to normal tissue, but that turns out not to be true. The ultimate goal is to first understand the basic principles of tumor immunology and how to manipulate the immune system. And then the second is to apply those insights to actual developing new therapies.
There's a robust cancer vaccine program at Siteman across a number of disease types. There is a growing awareness of what that means.
We're looking at therapeutic vaccines, which means here's a patient that has cancer. Can we awaken their immune system and force the immune system now to see that cancer as a foreign invader and kill it off? We develop new concepts in terms of understanding the basic principles of the immune system's interaction with cancer. But we get insights from that from our clinical colleagues. And then our clinical colleagues take those insights and move them into patients. There are a large number of clinical trials going on using the immune system to fight cancer here at the Siteman Cancer Center. We really have two major programs in our center. One is the use of a patient-specific approach to cancer immunotherapy, which involves essentially making vaccines against a patient's own cancer and using that for the immune system to destroy the cancer. The other is to use some of the soldiers of the immune system, the effector cells, the T cells and B cells, that keep us healthy, but also can be trained to destroy cancer. And so we're pushing on both of those fronts.
Are there things about one patient's tumor that are the same as another patient's tumor? The likeliest scenario is actually every patient's tumor, except for a few exceptions. Those sets of mutations are very different. And then when you then understand that, well, the way that the immune system and T cells recognizes anything foreign requires recognizing these HLA molecules, well, that's a very, very diverse set of molecules, except if you're identical twin, they're different in all of us. Those little molecules that show the immune system what's different about a tumor cell. So we're trying to understand that interaction. My motivation to do that really was deepened when I was a medical student here at WashU, and I was an MD PhD student with Dr. Schreiber, who's one of the heads of the Tumor Immunology Program now, so we've come full circle. It was extremely formative being a PhD student in his lab and understanding what incredibly high-level research means, and that's really the space that we're in, and I think that that's something that's so well supported at Siteman.
The immune system can detect a single amino acid change in a very large protein made up of thousands of amino acids. And if it's in the right place, that immune system can react against that. We have a number of ongoing clinical trials. Some of them are incredibly exciting, yielding results, maybe not curing cancer yet, but certainly preventing recurrence of cancer after, say, for example, surgery and chemotherapy. Clearly, our scientific strength rests in the marriage that we have here between basic research and clinical research.
We try to take the best care possible of our patients, so we have great clinical colleagues. We have excellent translational and scientific programs. We work with our Siteman colleagues every day, and we see, what that means, and I think there's that idea of excellence every day sort of infuses the place.
People on both sides work together, and that's the strength of the Siteman Cancer Center. It's this collaborative atmosphere that we have here.
As an institution, I would imagine that the exceptional rating means that collectively it is doing everything it possibly can to improve the lives of patients with cancer in the region and around the world.